Hey everyone, this is like the third time I have tried to start this video. I started downstairs and I didn't like the lighting and I had a shirt on that just, the video didn't look right, so third time's a charm. Today I want to talk about bone grafts and sinus lifts, okay? I have seen a lot in my group. There's several people that have had to have those. So I looked it up because I may have to have one when I had the lowers extracted and the implants put in. So I was kind of wanting to know what the recovery time is and things like that. So I thought I would share with you guys in case someone has a consultation and finds out they have to have a bone graft or a sinus lift. Okay. When you have your teeth extracted, you start losing bone. I believe, now don't quote me on this, but the older you are, the faster the progression of the bone loss, okay? I had like 4 teeth left on top over here. My front teeth and all these over here had been missing for about a year before I had the rest extracted and had the implants put in. In that year's time, right before I went to have the rest of the extractions and the implants put in, I noticed that my lips started sinking. So if you're someone that has all your teeth extracted and then waits a period of time before you have the implants put in, there's a very big possibility that you may have to have a bone graft or a sinus lift. Okay. I did not know this until I talked to a dentist and started researching last night. But a sinus lift is actually a bone graft that goes into the sinus. So I thought, well, if you have to have a bone graft on the upper, that's called a sinus lift. If you have to have a bone graft on the lower, it's called a bone graft. But it's called a sinus lift if you have to have a bone graft in the sinus, okay? I've got some notes here, and I'm going to read from those. Give me 1 second. Okay, guys. Let me say this before I continue. I am not a dentist or dental professional. Any information I get for these videos I do is either from research that I do on my own or from a dentist. Most of the time, I get my information from Dr. Robert Emilio, okay? And he helped me with the information for this video. He has a blog. He also has a YouTube channel. I am going to post the address for his blog in the description of this video. He has a lot of great information there, okay? But I asked him about the whole bone graft versus sinus lift. And what's the difference? Are they the same? Here's what he said. Okay, when a bone graft is placed in the sinus, it's called a sinus lift. In addition, a bone graft can be placed into an extraction site. That's called a post-extraction graft. Bone graft can be placed on top of bone, which needs to be widened for an implant. That's called an onlay graft. He also says that he has written about this in his blog, and like I said, I'll put the address for that in the description. He says he actually has the actual surgery for a sinus lift on his YouTube channel, so I will put the link to his channel also in the description. If you're somebody that has to have a sinus lift or a bone graft, and you have a weak stomach or you have bad dental anxiety, I would suggest that you probably not watch the video. Now, I'm going to kind of get off tangent here for a second, but yesterday I had 2 comments come in that were replies to a comment someone else made on one of my videos. And the comment was, implants are not necessary, dentures, something to that effect or something like that. And I deleted the comment. And I don't know if the person is watching that made that comment, but I kind of wanted to address it. I will agree that implants are not necessary. But if you are a young person or someone that wants to maintain your facial structure, I guess is what I'm trying to say, implants are necessary. Because when you have to have all your teeth extracted, you are going to lose bone and your mouth is going to start to sink in. Okay, with that being said, for some people, that does not matter. For me, that was a huge concern when I found out that I was going to have the rest of my top teeth extracted. So that is one of the main reasons that is the number one reason why I chose to get these mini implants on top, was to maintain my bone. Now, I don't want to offend anyone, but because there are some cases where someone needs to get the teeth extracted for now and get dentures and they may not be able to afford implants. But the most important thing for you is going to be getting those bad teeth and that infection out of your mouth. That is number one top priority. You can always get immediate dentures. Let yourself heal. Give yourself some time to come up with the money or a plan to get implants. Okay, now, since I've said that, let me read what I pulled up on dentalworks.com, okay? Fortunately, with modern bone grafting techniques, the bone that has been lost can be built up again. This can benefit both your health and appearance by strengthening your jawbone, allowing more effective tooth replacement, and increasing support to your facial features. So, again, if you have infected teeth in your mouth and you cannot afford implants right now, concentrate on getting those infected teeth removed. Get immediate dentures. Then you can go back to the table with getting implants. Now, I wouldn't wait too long, but you could, I'm going to say, I don't know. I'm not going to say it because I don't know for sure. But I went for like a year with most of my teeth gone. So, now let's talk about the grafting material they use. Because I was wondering, and from what I read on dentalworks.com, they can either use your own bone or a donor. I asked Dr. Robert Emilio what he uses, and he said a donor. Actually, his response was donated, cadaver human. This is called allograft. Okay, dentalworks.com says the grafting material itself can come from your own body, but very often it is bone from an animal or human donor that has been treated by a laboratory to make it sterile and safe. It can even be a synthetic substance. Grafting material comes in a variety of forms: powder, granules, putty, or a gel that can be injected through a syringe. The graft, which is generally covered by a collagen membrane for optimum bone repair, will act as a scaffold onto which your body will build new bone. Okay, now, let's talk about what to expect as far as recovery time, because that was another thing that I wanted to make sure I got out to you guys. The procedure for placing a bone graft usually only requires a local anesthesia, though oral or IV sedatives can be used to achieve a higher state of relaxation. So, since a small incision is made in your gum tissue to gain access to the bone that will receive the graft, you may experience some soreness in the area after the surgery. This can usually be managed by over-the-counter anti-inflammatory medication or pain relievers, as well as ice therapy after the procedure. Any discomfort should only last a day or two, and then over the next several months, your body will replace the graft with its own bone, reversing the decline in bone quantity you have experienced. Okay, so I asked Dr. Emilio again about the recovery time. He said usually 2 days off work. He said, and then for the next couple weeks, light physical activity and no gym time. Now, if you are having bone grafts for implants, which more than likely that's why you would have a bone graft, you would have the extractions first. I don't know. I think maybe that sometimes they do bone graft day of extractions, or extractions and then come back and do bone grafts. But once those bone grafts are done, generally it takes 4 to 6 months before they will place the implants. And then once you have the implants placed, you're going to have, I would say, 2 to 3 months of recovery time before you get a permanent denture now, or permanent snap-in or permanent bridge. Now, I do know people that have had implants placed, and if they do the all-on-4, some dentists will go ahead and screw a temporary bridge in. Some will put an immediate denture in. It just depends. Depends on the person, depends on the dentist. For me, I had the extractions first in June, implants in August, and I wore an immediate denture for almost a year, and then or over a year, and then had the permanent snap-in put in, and that worked great for me. I healed fantastic, and I haven't had any trouble, knock on wood, thus far. But main thing, this whole thing just takes time. It's a process. You can't hurry it. For best results and for your best interest, I think it's better to do a staged approach. Now, I told you guys at the beginning, bone grafting and sinus lifts is something I wanted to know more about, because when I go to have my lower teeth extracted, I may have to have a bone graft. I'm not sure. So I kind of wanted to know what the recovery time is and the things I've gone over in this video. Okay, guys, that's really all I have on the bone grafting sinus lift thing. I want to say thank you to all my new subscribers. I started this channel. It'll be a year at the end of March. At the end of this month, at the end of March. And it's just been fantastic. I have learned so much. I have gained so many friendships with some great people. It's truly been a blessing. Thank you to all my new subscribers. Thank you to people that have been with me for this journey. If you're not subscribed in my video, or any of my videos have helped you in any way, please hit that subscribe button. Right now, I work full-time, but I don't know how much longer I'm going to be able to do that, as my mother, health, mental health, she has dementia, is declining. There's going to be a point in time in the near future that I am going to have to quit my job to take care of her. So the only thing I will have will be my YouTube channel. So if this video or any video has helped you, please hit that subscribe button. Now, I still do not know when I'm going to start the process with extractions on the lowers and implants. My next dentist appointment is on the 21st of this month. I have an appointment for a reline for the upper snap-in horseshoe. And that will be, he will go over a treatment plan for my lower. So I will record as much of that appointment as I can. But that is what is coming for the channel. So I hope you guys have a fantastic week. Have a great rest of your Sunday. Wherever you are, it is nasty in Kentucky right now. It is sleeting. It is cold. I'm ready for the spring. So have a great week, you guys, and I will be talking to you soon.